I have the pleasure of working with Pat at UBC. She's a physiotherapist and a researcher and jumps around from St. Paul's to UBC. Her presentation today is entitled Early Rehabilitation and Acute Exacerbations of COPD, a Knowledge to Action Approach.
Trying to figure out if there's a laser. I sense. This one?
Middle button, yeah, it's not a very bright laser.
Okay. I don't know if we'll be able to do it, but can you even see it without putting out Anne's eye? Okay, well, we'll have to figure that part out when we get to it. So today I want to talk a little bit about rehab and take us to the acute care setting in the hospital where I work and where my research lab is focused. And so I'm interested in rehab for hospitalized patients that have an acute exacerbation of COPD. So I tried to kind of condense this very short talk into three kind of key areas of interest in the things that I have learned. And one thing I'm aware of from my practice and from the research is that there's a real culture of convalescence that's happening for hospitalized patients with an AECOPD. And how do we know that? Well, there's quite a lot of research that has been done that has actually measured activity in these patients. And this isn't just by asking patients what they do, it's actually going and measuring with different activity monitors how much patients are active while they're in the hospital, and they're not very active at all. Now, we would argue that, well, they're sick, of course they're not active, but actually there's a bit of a bigger story to think about. We did a study at St. Paul's where we looked at the relationship between mobility, so what patients are able to do as measured by a physiotherapist, and their 6-minute walk test, which was the walking test, how far you can walk in 6 minutes. And not surprisingly, there's a pretty good relationship between what a physiotherapist measures in terms of the patient's mobility and their 6-minute walk. And so you can see there's a nice upward line. The higher the mobility scale, so 0 to 100 with the DEMI, the greater that you can walk. And the opposite is true. If you're not very mobile, of course, your 6-minute walk test is lower. So that seemed to be okay. Well, the sickest people are the ones that aren't being very active. They're not mobile and they can't get around. But then we measured their mobility and compared it to what they were actually doing in a day. So we put activity monitors on patients to see how active are they. And it turns out there really is no relationship between how mobile you are as measured by a physio and what you're actually doing. So extremely mobile patients that are, if you look at the top left-hand corner of the FAR graph, they're scoring 100% on their mobility, and they're basically immobile for the entire day. So there seems to be, of course, sicker patients are going to be less mobile, but there seems to be an issue where these patients are not doing much while they're in the hospital, and it's not just because they're sick or they're frail. So what are some of the reasons for that? Well, one area that we're interested in is looking at some of the issues around the confidence or the comfort level of the different healthcare professionals who are working with these patients. And it's well known by a number of different studies in different countries that about 1/3 of new physiotherapy grads are not feeling very competent in working with cardio arrest patients compared to some of the other patient populations. And they consider the acute care setting and working with patients with COPD to be an intimidating area. It's a very complex, dynamic place if you work in acute care hospitals, and it can be a challenging place for new grads or people that are new maybe to that particular area. So there's been lots of different initiatives to try to help with that, and one thing that we were involved with was developing a bit of a practice guide in order to support clinicians who are working with these patients. And we called it AECOPD MOB. It's an extension of the SAFE MOB, both of which were supported by PABC. I'm not going to go into detail now, but if you're interested, we have a website, and you can visit the website and download the guide. So that was the second area, was that, okay, maybe if people are not being mobilized on the ward, it might be because the healthcare professionals don't feel like they have enough support to do that, and so this provides some of that. But it's not just going to be about individual patients and individual therapists. We need a more structured approach to helping these patients. And so their actual formal rehab is desperately needed for these patients. It turns out that about 10 to 20% of our COPD patients that are in the hospital are readmitted within 30 days. And that's not a new exacerbation. That's basically they're going home, they're being discharged, and they're relapsing, and they're back in. And this is a much higher percentage than any other chronic or acute care patient population like stroke or cardiac patients that come in. Despite this, there is really no formal AECOPD rehab programs that are available. And these patients can be very frail and can need complex rehab and can have potentially an impact on their readmission rate. And this particular graph, it's a bit hard to see, but it's a summary of a number of different studies that looked at the benefit of inpatient rehab delivered by physios on readmission rates. And it turns out that an inpatient rehab program can reduce the risk of readmission by 75%. So that's our potential contribution to being able to bring those rates down and to be able to have those patients stay home and stay healthier. So of course, the last area is, well, how are we actually going to do this? And some of the areas that we're interested in working at is looking at maybe we can develop things like student-led clinics to work in this area, or think about more home-based rehabs, rehab programs, how can technology potentially help us? So I'd like to close by saying thank you for the invitation, and if you're interested in hearing a little bit more about this, my email is there. If you'd like to be involved in some of the work as a participant or as a team member, you can follow us. You can come to the website and look at some of the descriptions of the research, or email me. Or if you just want to follow along and see how our research is going, we regularly post on our Twitter account. So thank you very much.